Okay, so today I'm going to speak to you about mixing insulins, long-acting and short-acting insulin. And first of all, to do that, we know that mixing insulin and administering insulin is one of the 3 controlled acts that nurses can do. And so in order to do that, we would need a physician's order. So today we have an order for Mr. Montpellier, and he is to have regular insulin, Humulin N. He actually has 40 units at 7:30 in the morning, and it's now 7:15. And with that, he also has an order for sliding scale insulin, Humulin R, and according to his blood sugar. So we would first of all need a doctor's order, and the next important thing that we would need is a blood sugar level. We would never administer insulin without having that blood glucose level. So we know that Mr. Montpellier's insulin or blood glucose this morning is 11.2, and so according to our doctor's orders, we're going to give 40 units of Humulin N at 7:30, and the sliding scale says that if his blood sugar is between 10.1 and 12 millimoles per liter, we are going to give 4 units of Humulin R on top of that. So that's how we're going to draw them up together. So we have the doctor's order, and we have the medication record where we're going to sign off the medication afterward. So just to ensure, first we would make sure that our cleaning work area has been disinfected, which I did prior to this using the Virox wipes. And then I'm going to make sure I have my supplies. So I have the Humulin N, and I have, which is the long-acting insulin, and the Humulin R. I have the 2 insulins as well. Some clients actually have their own insulin pens, and they actually come and are very easy to use. They come with a little cartridge, and the client just dials that dose in. But in this situation, we're using the hospital stock. We also need to make sure that we get the insulin syringe, and this syringe actually comes equipped with a needle. And the needle is a 1/2-inch needle, and the difference between the insulin syringe and the other syringes is that the insulin syringe is measured in units as opposed to milliliters. So this is actually 100 units as well. So we have that. And in addition, because we're going to use these brand new bottles, once they are open, they're only good for a 30-day window of time, and they need to be labeled with the date and the time as well. Okay, so we've got various labels here. As per the agency policy, we would make sure that we put the date and the time that those bottles were opened, and they would be refrigerated. Okay, so again, just to recap, we are going to give 40 units of Humulin N, and according to the sliding scale, an additional 4 units of Humulin R. So I'm going to complete my hand hygiene. And I'm sure I have all of my equipment. I'm going to open up my packaging with my syringe. And these are new vials of insulin, so I'm going to remove the lids off them. So I have both removed, and once these have been opened, they're good for a total of 30 days. I'm going to make sure that I actually warm each of the vials within my hands for about a minute or so, just rotating them back and forth to warm them because they typically come from the fridge. And this one as well, so for 30 seconds or so to a minute, we're going to warm them. Okay, so now when we are mixing our insulin, we have our long-acting insulin, which is our Humulin N, and we have our short-acting insulin, which is the Humulin R. And this one is clear, the long-acting is cloudy. So what we're going to do first is wipe the tops of each of the vials. And then we are going to make sure that when we draw them both up, we always insert the amount of air into the vial first. The amount of air should be equivalent to the number of units of insulin that you're going to remove. We will insert the air into the Humulin N first, the long-acting insulin, and then the Humulin R. And then we will withdraw that amount of insulin from Humulin R and then back to Humulin N. So I'm removing that. And the first thing I'm going to do is I'm pulling back on the plunger to 40 units. And I'm going to inject 40 units of air into my long-acting insulin. Then I'm going to pull back 4 units of air and inject 4 units into my short-acting insulin. Without removing the needle, I'm actually going to make sure that the tip of the needle, the bevel, is underneath the liquid. This is a full bottle, but certainly you want to make sure you may have to pull your needle out to make sure that it is always underneath the level of the liquid. And now I'm going to withdraw 4 units of Humulin R, which is your short-acting insulin, the clear. Now I'm going to take that with the 4 units and I'm going to put my needle into the Humulin N, and I'm going to pull the plunger back slowly until I get to 44 units. It's very important that you draw up the short-acting insulin first and the long-acting insulin second, because if by accident you got a little bit of the short-acting into the long-acting, it would not be a huge concern, but it could cause serious consequences if it were the other way around and the long-acting ended up into the short-acting bottle. So now I have 44 units of insulin. Typically we don't recap, but because I want to go into my patient to administer, I actually take my syringe and needle and I just slide it to put my cap on like this for safety reasons.